Hi.
Yes. Hello.
So we have Gigi with us, who's the most happening gynecologist in town. So we have a lot of questions for you.
Yeah.
Some fun, something that we need to really know about, etc. So let's start with what this month is about. This month, October, is known for breast cancer awareness. Could you tell us few things that every woman should look into or take care of when it comes to breast cancer or prevention of breast cancer?
See, breast cancer is something which very, very easily we can detect if you're really, if you really do certain things on a regular basis at home, rather than going to a clinic or a hospital. If you do a little, which is called the self breast examination, which is a very simple thing to be done at home and can be diagnosed very early. As we all know that, there are certain symptoms of breast cancer, like, small breast lump and change in the color of the breast, the itching, the discharge from the nipple. Like when you're talking about a self breast examination, first and foremost, what I always suggest in all my talks is that every woman should be aware of their breast, like how it looks. Like you should look at it in the mirror, feel it, and then you should know your body basically. Just like
ashamed of it.
You shouldn't be ashamed of it. You should know how your breast is. That only when you know what your normal breast is, you'll be able to detect what an abnormal breast changes are.
Yeah.
So always make it a habit. That comes as part of the self breast examination. Make it a habit to have a self breast examination. Like say fix a particular day in every month. Like maybe right after your period. Suppose if you're having a period, fix it as a 7th or 8th day of your periods.
Yeah.
Do a self examination. Look at the mirror. Undress yourself. Look at the mirror and see the size of the breast, shape of the breast. Feel for it and feel for any changes. So once you know what, you look at the mirror and see yourself and you keep seeing what is your normal breast. Yeah. So the moment you start having some changes, let it be color change, you'll be able to. Yeah. Once you don't know how your breast looks like, you will not be able to pick up the slightest changes. You might think, it's always been there. No. So there, the importance of, looking, inspecting the breast and feeling for your breast, for the changes, it's very, very important, which anybody can do. Like, irrespective of whoever it is, everybody can do it at home.
When we talk about breast lump towards the, menstrual cycle or towards the day of your periods, generally you start to develop a small lump appearance, right?
Yeah.
And I have had, even siblings of mine or patients of mine ask me that, how normal is it? What is a normal, lump during that time? Is it normal for everybody? Because I think Pandu Mudale, it's a taboo for all of us to talk. Even though we have a lot of girlfriends, or even in school, even though we studied with a lot of girls, it's very rarely that we all spoke about our breasts to each other.
Yeah.
So what would you say is a normal lump during that time? When does it dissolve? Like changes that happen to your breast during your cycle?
Yeah. See, it's always been, like you said, it's always been a taboo to talk about, just not about the breast, about the, right, even the periods or even the vagina, or like it's always been a taboo talk about even between the girlfriends. Yeah. So like when you talk about the breast, see, there are, depending, there are physiological changes which happens during a cycle. Accordingly, there are slight changes which you feel, like just breast congestion, like many women feel a breast congestion right before the periods, which settles down as soon as the period sets in. That's also part of the hormonal changes which happens. So when not necessary that every woman will feel that lump during the periods, but yes, there is certain cystic changes which you feel. But breast lump is the typical of we call it a breast fibroadenoma or cancerous or non-cancerous breast lumps. They are very different from the normal breast changes which you feel during the periods. They are so typical, like benign tumors, like non-cancerous breast tumors, like we generally call it fibroadenoma. They have very typical features. It's like small, like something like a ball. When you touch it, it keeps moving. It's like it's mobile, very mobile.
It's not a large mass.
It's not a large mass, even if irrespective of the size, could be big or small.
Yeah.
But it has a very typical feature wherein you will definitely feel it. When you touch it, you're going to feel it like something like a small, regular, small ball-like which keeps moving. That's usually whichever the moving lump is generally considered as a non-cancerous. But in case of the cancerous breast lump, they are again not really depending on the size. It could be small or big. But then when you feel it, they are really hard, and you can, comparison to the rest of the breast, you can actually feel a typical, something very hard.
You can distinguish.
Yeah.
Okay. You mentioned that not just breast, we also hesitate to speak about vagina.
Yeah.
What is a normal vagina? Like, there are some people who say, I have had discharges. Some who say there are slight foul smell that I experience. Or naturally, my vagina has a smell. Or, things like that. So, what is a normal vagina? So then, they can understand if what they have is something different from that.
See, just like how we said about the breast, like when you know what is normal, you will know what is abnormal. Same with the case of vagina also. See, when in vagina, the discharge which normally we see, I'm sure every other woman will feel it, which is a normal discharge, which is like a cleansing. Vagina itself has its own cleansing mechanism. That's why we generally, that's the normal discharge which we feel, some kind of wetness which you feel in the panties. That's a very normal, healthy, discharge, which like I said, it is a part of the cleansing mechanism which maintains the healthy, normal, vaginal pH and the epithelium. It itself has a normal cleansing mechanism. But of course, when there is alteration in this, the normal vaginal epithelium and the changes, the pH and all those changes, like say in case of if there is a source of infection, then the consistency of the discharge changes. Like right from the color of the discharge, and the patient will start itching. Along with the discharge, the patient starts itching, and then maybe foul smell. Foul smell is always a source which always indicates there's a source of infection. So as long as it's a mild discharge which is not really bothering you, you should understand it's okay to have it. But then yes, of course, when it's really bothering you and if it's associated with itching or foul smell, then yes, definitely you need it. It could be a symptom of anything. It could be a simple void discharge to it could be as severe as a cervical cancer also. So no symptoms are to be ignored. Always go consult, and in case in any kind of this kind of problem, and generally there is a tendency for these kind of especially reproductive health related issues, there is a tendency for women to push it. Like it's not like having a fever or a cold headache. And you don't really generally talk about, and even the itching vagina, they consider it as it's something not to talk.
They have to be
ashamed of, but they don't even talk it. Max to max, what they do is talk it to their close friend, and then they advise like, why didn't you go consult? And that's how. So that's not like a vast majority of the women don't really approach as soon as they get it. Things have changed very much these days, but then still there is still a not like I said, not like any other getting a fever or cold. There's always a thing pushing them back. Going to.
Now, how good is an intimate wash? These intimate washes that they use, and there are some people, because it's very easily available now in supermarkets, Blinkits, Instamart, everywhere it's available. Is there a duration they are only supposed to use this, or is it like a daily thing or a weekly thing? What do you suggest?
Generally, a vaginal wash is generally not required on a daily basis, because, like I said, vagina itself has a healthy cleansing mechanism on its own. So generally,
even soap is not required.
Nothing is required. Just washing it with a plain warm water is good enough to maintain a healthy, max to max. In case if they are having some infection, only in that case I would suggest use it for that time period, as long as they're having this source of infection. Once that's done, in short, you don't need a vaginal wash on a regular basis for a lifelong.
Another thing that I wanted to ask you is, when it comes to a yeast infection or when it comes to a fungal infection between two couples, is it that only a husband can contract it from a wife, or can a wife get it from husband as well?
It can be either ways. So that's why whenever it's an yeast infection,
there should not be any blame game.
No, there is always a blame game in the reproductive game. So there is, it's not a blame game. After all, whenever there is an yeast infection, it's better to get both the partners to get treated. So it can be either ways.
So now another thing that we have been hearing a lot is PCOS and PCOD. Every kid, every teenager, every one who has a social media, first thing that they start with is, I have PCOD, I have PCOS, which I feel is good that they have an awareness. But do you think generally there is this overuse of this word?
Yes.
And what exactly is the difference between PCOD and PCOS? Because I think a lot of them doesn't know the difference between these two.
Yeah. Things have really changed over the past 10 years. You wouldn't hear a lot of PCOD when I sit in my OP. I usually don't hear so much of PCOD, PCOS when I was doing practice 10 years back. So that way, every other, in my OP, when I sit every day, the other patient is with a history of it. Even if they are coming with some other, like say, vaginal infection, they'll tell you, no, I also have a history of PCOS. I mean, that's there for everyone, even if they are not coming for the particular thing. So that's like, every household has a PCOD or PCOS. So there is a big difference between PCOD and PCOS. PCOD is the mildest form of, basically, what is PCOD or PCOS? It's basically polycystic ovarian disease or syndrome, which means there are small fluid-filled spaces in the ovaries. So that multiple fluid spaces are called the polycystic ovarian disease. So PCOD is basically a simplest form of the condition, or you can say a precursor of a PCOS. PCOS is a more complex, severe form of the PCOD. Like say PCOD, that is the disease. When it's PCOS, it's a syndrome. Syndrome is always a combination of multiple problems. So disease is slightly milder than a syndrome. So in PCOS, it's milder, wherein there is only slight hormonal changes, and because of which the cyst is formed. It's mainly restricted to the ovaries itself. Whereas in syndrome, that's PCOS, it's whole of the endocrine and the metabolic system. Everything is more complex than this thing.
What are some symptoms that they tend to see in PCOS?
See, in PCOD, so before that, when you're talking PCOD, it's usually only irregular cycles, irregular periods followed by the polycystic ovaries in the ultrasound. It's just that. But when it comes to PCOS, it's more complex. Like I said, they'll have all associated. It's not just irregular cycles. They might have the acne, pimples, then hair growth, and then weight gain. All this, and more than anything, there are so many long-term, metabolic disorders like type 2 diabetes, heart conditions, which can happen over a period of time. That's a long-term complication in case of PCOS, which is not there with PCOD. So in case of the patient is having only PCOD, the treatment would be only to correct the lifestyle. Only the lifestyle, not really medications, just the lifestyle correction will do. But whereas in PCOS, it's not just lifestyle. You might have to go through the hormonal tablets and different other medications to bring down all of this.
What is the ideal way to manage this lifelong? Like, you cannot depend on pills. You cannot depend on, medications. What would you tell a person, a lifestyle that you would ask who has a PCOS to follow so that this is brought under control, because it is a lifestyle disorder?
See, these days I think most of the things are actually related to lifestyle, not just PCOS, PCOD. There's so many things which are related to the lifestyle. In specific to PCOD or PCOS, the lifestyle would be definitely, and most of the women, most of the cases with PCOD are overweight on a slightly, not necessarily. There is a lean PCOS also, wherein you see PCOD in young, definitely there. But then if it's obviously there is overweight or obese, the first line of treatment is always a lifestyle correction, wherein diet, and getting the weight under control, and specifically targeting the diet, exercise, proper hydration, weight management for sure, and then stress. Stress is a major cause for all of these hormone changes, and even directly related to the PCOD, PCOS. So stress management, weight management, like diet and exercise, and even a proper sleep, 8 hours, something which is very under addressed is like having 8 hours of good sleep, which is again very, very important for stress and weight are, I feel, always very under addressed issues in everyone.
And do you also agree the fact that women need more sleep than men?
Yes, continually. Anytime. I'm sure there are so many men who are going to go against it, but yes, I feel we need a very good sleep.
So today we just had a conversation regarding that women should have at least 1 or 2 hours more sleep than men. So which is why I started with that topic. Now, when it came to PCOS, we spoke about ovaries and ovarian health and all. When it comes to this era, this current era, the phrase that is your biological clock is ticking, how apt is it? Like, now we have egg freezing, we have different methods. Do you still look at your age, timeline? What is your perspective?
See, some things you cannot change, is like you said, the time cannot be changed. As a human body, it's a fact. However changes happen, it's a fact that as you age, as the time passes by, the quality of the egg in a woman, it decreases as per age. So yes, definitely this is mainly, the phrase is mainly important with regard to the fertility, like considering the egg quality itself. So though as age advances, like why the egg freezing and all things have come up now, because now women are more like they're more career oriented. They want to settle down, financially independent, and then get married and have children. This was not the thing few years back, definitely. So yes, it's definitely good, but then in that case, this should also be considered that as they wait and this thing, their quality of the egg is coming down. In that case, results like egg freezing, yes, definitely is helpful. Or if they are planning, like it should ideally like before 35, that's what we say. 30 would be better, but then if not before 35, the family should have a baby.
Now, when it comes to menstrual cycle, a whole woman's life is surrounded with things regarding menstrual cycle. There is your menarche, and then you have your PMSing, and then you have your monthly cycles, and then comes your menopause. So when it comes to a healthy menstrual cycle, how would you identify it? What is a healthy menstrual cycle?
See, generally, theoretically speaking, a regular menstrual cycle, which means about every 20 periods, which happens every 28 to 30 days, that's considered as a regular cycle. We assume that a menstrual cycle is good. We are having a good menstrual cycle, considering one is the time. Again, if the cycle comes every 28 to 30 days, one thing, and then the duration of the cycle, that's like around 7 days of cycle, which is good enough. Anything more than that, roughly more than that, or anything very less than that is considered abnormal. So as long as you're having a 28 days cycle, not really 28, but then roughly 28 days, and then you're having a duration of 7 days, then you can assume that and the amount of bleeding as well. As long as it's not very excessive bleeding, you know what your normal is. So as long as it's not very excessive bleeding, you can assume that you're having a regular cycle.
Anything cramps?
Cramps could be normal, like it could be normal or abnormal. So if somebody, if it's unbearable, say there's always been a myth that no, that comes as that's part of regular periods. It's okay, you don't have to take medications. That used to be typical parents. So you don't have to take tablets and all. It's not like that. Like in case if it's a pain is unbearable, there are medications which are primarily targeted for the pain relief and for the periods pain related. So there's nothing wrong in, not that you're taking it on every day liberally, but then if indicated, yes, definitely there's nothing wrong in taking these kind of medications. So like I said, the dysmenorrhea, that's the pain during the periods. It could be normal, it could be a periods related normal cramps, or it could be as a symptom of any other, like some symptom of any other conditions like an ovarian cyst or a fibroid. It could be that also. So
it's better to come address it, get it diagnosed.
Get it once you make sure that everything is fine, and then
Nowadays, another one topic that is very common is the usage of sanitary napkins or cups or panty liners not during cycle but later on. What do you, and people who use cups says that is more healthier, so there's a whole debate happening every time. So what do you think is the suitable?
Okay, I personally feel menstrual cup is that I studied, I reviewed, and I personally always recommend menstrual cup for all my patients. It's again, some people, they are used to the sanitary pad for years. Switching to a new product suddenly might be a little, difficult for them. But then, if you see menstrual cup, I would say, in case of if you know the correct technique of insertion, the correct size of the menstrual cup, and the correct technique of insertion, then that works very well. Or if not, but
even for a person who has heavy bleeding, clots, all of that.
Yes, all of that. Even with so many doubts with related to menstrual cup. Yeah, I've taken so many classes also with regard to menstrual cup. So very common questions which come with regard to using a menstrual cup. One is like in case if I'm having a copper tea or a marina, can I use a menstrual cup? Yes, you can use. Then excessive bleeding, like what you asked, excessive bleeding can I use? Yes, can be used. Only thing is, when if you're having excessive bleeding, then you'll have to change it frequently. Then someone who's having less bleeding, if you're having excessive bleeding, you need to change it frequently.
So when it comes to pad, we always say change it in 3 to 4 hours. No, when it comes to menstrual cup,
again message is the same, 3 to 4. Again, depends on if it's a small, the capacity of the menstrual cup. If it's a small, less a capacity, small, medium, large. So usually around, depends on the bleeding, just like the sanitary pads. You have to change it if it's the bleeding of more, excessive clotting. Same with that. If it's a full, or if it's bleeding is more, especially in the initial 1 or 2 days, you might have to change it frequently.